We had three groups in this study. In group 1, we injected bevacizumab in a pre-filled 1 ml syringe. In group 2, we had ranibizumab in a proprietary special small volume low dead space designed syringe provided by Genentech. Third was aflibercept, which was actually drawn by the physician into a regular 1 ml syringe and then injection. So we have three different combinations of three drugs, syringes, and drawing techniques. We found that in groups 1 and 2, the bevacizumab and ranibizumab, the accuracy was pretty close to 50 ml, and they were not significantly different from each other, but the accuracy of group 3 was lower. Regarding precision, it was best with a specially designed syringe of group 2. We believe that our results do not reflect any difference in the drugs that we inject, but rather are due to the syringe and drawing technique. And using a small volume, low dead space, specially designed syringe actually achieved good accuracy and good precision, better than in the other groups. So one of the important takeaway messages of this study is that likely there is a need to design a special syringe for intravitreal injections that are extremely common and are done in the millions worldwide per year. A syringe will improve accuracy and precision that may be of clinical benefit and also provide maybe additional safety, because injecting too high a volume can cause an IOP spike. Surprisingly, about 80% of the injections, the volume delivered was higher than 50 microliters, and in the remainder it was a little bit lower. Again, we're not saying this has a lot of clinical or therapeutic importance, but still you don't want to under-treat patients, and you don't want to over-treat or just over-deliver and cause IOP spikes. So we really believe better accuracy and precision can be achieved with a specially designed syringe. And probably the traits of this syringe are that it would be a small volume syringe and have a low dead space plunger design. In general, real-world data is what actually interests practicing clinicians. The conditions achieved in the laboratory or even in large clinical trials are usually optimal, or to say the least, much better than what happens in real life. Large real-life studies have shown that we do not achieve the same results as we do in clinical trials on real patients. Another important aspect of evaluating real-world studies is knowing what is actually being done, and that can also help you figure out where the pitfalls are and what you can do to improve. Even outside the field of this study, real-world data is very, very important, as it helps evaluate how the clinicians are implementing what the studies are showing. And if the results are incompatible, these studies shed light on what can be done to improve our results.